Hello everyone, this is Dr.SHIVA Ayadure. We're going live tonight. We're going to talk some more about vitamin D and some of the interesting research that just came out. And I hope you guys are doing well. I'll just review what happened today. And then let me just shut off this Do Not Disturb. Anyway, hope everyone's doing well. This is Dr.SHIVA Ayadure. The title of today's talk is Vitamin D Defends You, and essentially how the mainstream media is in fact being forced to acknowledge the power of vitamin D. If you know, a few days ago I talked about what's going on with vitamin C and the fact that an ER doctor was saved by high dosage vitamin C. This was just about 4 or 5 days ago. You know, it's very interesting. I've been doing this content to really educate people, and sometimes you find that copying is the best form of adulation. So I'm pretty happy to see a lot of different people starting to take this, discuss it, and including the mainstream media is being forced to acknowledge about vitamin C and vitamin D. So I want to today talk about vitamin D because today was an extremely beautiful day. We had a wonderful day. We went over to Minuteman National Park. I gave a speech. You know, they limit the number of people that can come out, but about 40, 50 people came out. It was quite nice. We just put out the notice literally 2 hours before, but it was an amazing, you know, spring day, or the beginning of spring day. A lot of sun, and we have to understand the sun is one of the most healing things for all of us, even if you get 10 to 15 minutes a day. Obviously, if you're a little bit darker in skin color, you need a little more because of the fact that the UVB radiation takes a little more to penetrate. But nonetheless, vitamin D is extraordinary for the human body. It's an extraordinary antimicrobial. So what I want to share today is just quickly review, for those of you who may have missed it, how vitamin D defends you. And then I want to show you a study that just came out about 4 or 5 days ago, done in Ireland, April 2020, about I think 5 or 6 days ago, which further proves in what's called the longitudinal study the power of vitamin D to have significant effects in lowering respiratory infections, which is what we're talking about here, whether it's coronavirus or whether it's any kind of other kind of virus in terms of the flu season that comes out, especially when it hits the lung epithelial, on the power of vitamin D. So I hope you're going to enjoy this, because you're going to learn a little bit of chemistry, a little bit of systems biology, and then we're going to cover this report. And then we're going to show you, in fact, what the New York Times is now acknowledging, what I had put out there over 4 or 5 weeks ago. So that's good. And I think the mainstream media is doing this because as the content I'm sharing goes broadly, goes globally, all of you gut instinctually, you know something's wrong with this whole, you know, fear-mongering scam. And as the science that I'm, sharing it gives you that confidence to connect that your gut instincts were right, the mainstream media now, to save face, has to acknowledge the content that I've been sharing. So you'll see what the New York Times is saying and also these reports. So let's just sort of jump into this, if I may. If you recall, several weeks ago I shared a very interesting set of slides which really talked about how vitamin D destroys for you a molecular systems understanding. Now, just to make this very clear, you know, vitamin C is extremely well researched. As you see here, nearly 84,378 papers have been published in PubMed, 1,000 plus systematic reviews, 9 systematic reviews on acute respiratory infections. And just to be clear, in science, what a systematic review is, in a field where you have lots of people doing research, 80,000 papers, sometimes you'll take a block of those papers and you'll curate those papers, which means organize them and summarize them. That's a systematic review. The reason a systematic review is valuable is it helps you, and it actually makes it more efficient. Instead of you having to read the thousands of papers, someone organizes together. So in the case of vitamin D, as you can see, there's been a number of systematic reviews been done, about 1,000, but in particular 9 systematic reviews on acute respiratory infection. And remember, what we're dealing with here with COVID, coronavirus, or whether it was SARS or MERS, but you're typically looking at serious respiratory infection in the in obviously the lung area. So this is important that nearly 9 systematic reviews were done. The latest one that I reviewed last time was in 2017. Today, I'm going to review something that just took place in 2019, a follow-up with that, and something that just took place this month. But in the 2017 one, if you remember, it was 24 institutions, 12 countries, 11,000 plus participants. And to those of you joining up in Instagram, I'm posting this on YouTube. It's going live as well as on Twitter and on Facebook, so you can actually see the study I'm sharing on vitamin D. And this is what the 2017 test concluded, which they included 11,000 plus participants. Vitamin D supplementation was safe, protected against acute respiratory tract infection, survival, really increased survival in ICU patients, and greatest benefit was to those that were deficient. And there were multiple mechanisms of action to promote the effect of antimicrobial peptides. So I want all of you to, if you want to sort of show off to your MD friends, you can call them CAMPs or AMPs, AMPS, antimicrobial peptides, antimicrobial peptides. So when you consume vitamin D or it's created from the UVB radiation, your body actually creates these antimicrobial peptides. So think about the name, antimicrobial, which means it takes on microbes, be it fungi, be it viruses, be it bacteria, be it different types of pathogens that come into you, particularly the ones that I just mentioned, antimicrobial peptides. So let's walk through that. And what I'm going to walk you through is you're going to actually see how this works. So by the way, there are many aspects of our immune system, but 2 of them here are the innate immune system and the adaptive. The innate immune system is all those parts of the immune system that you're first exposed to when someone sneezes on you or exposed to a pathogen. It's your stuff in your eyes, your respiratory, your ears, your nose, your mucous membranes. This is where the virus first interacts with you. And as you can see here in the respiratory, in the innate immune system, that's called the innate immune system, you have macrophages, natural killer cells, neutrophils, dendritic cells, eosinophils, and basophils. And then there's a couple which sort of hug both, the T cells and as well as the natural killer cells. So this is your innate immune system. We're going to really focus on the macrophages today. And then your adaptive immune system is your B cells, the antibodies, your T cell, which generate your CD4s and your CD8s. And the reason that this is important is that your innate immune system is what takes on the virus first, when it first seizes it, and then your adaptive comes in later, which are the sharpshooters, which produce antibodies for it. But in the innate immune system is we're going to focus on today, and where vitamin D has amazing influence in creating antimicrobial activity. So here we go. So if you see here, what we see right here is, here's your nasal cavity. So, someone sneezes on you, or you breathe in these virus particles. Well, it goes down your trachea, and it can end up in your lungs. And if you look in your lungs, there are these amazing little organelles or structures called the alveoli. And the alveoli are these little sort of balloon structures, and this is literally where air exchange takes place to support fresh oxygenation of your blood. So the blood here's flowing through the capillary, and here's the endothelial here, and then there's an exchange that takes place within your epithelial cells in the lungs, and the air coming in, which is in red here, which brings in oxygen. So here is unoxygenated capillaries, blood vessels, and they're being oxygenated. At the same time, CO2 is going into your alveoli, and which has been taken out. So you breathe in, you're getting CO2, you breathe out, this goes out. Breathe in, breathe out. Okay? So that's what's happening there. And if you go look closer here, when a virus, like this coronavirus or any other virus for that matter, comes into your lungs, what actually happens? Well, the key thing is when those viruses come in to your lungs, your body, the innate immune system, because you have all these mucous membranes and then the epithelial, tries to first protect your lungs from that attack. And the way that it does that is through this process of protection of the airway epithelium from pathogens. And the epithelial cells really form the physical barrier against the pathogens. Your airway epithelium actively contributes to the innate immunity. Now in macrophages, secretion of antimicrobial peptides, those AMPs takes place, and the cathelicidin AMPs, so remember that word cathelicidin, are critical to antimicrobial activity, and vitamin C is essential to these cathelicidin AMPs. So you have antimicrobial protein, peptides, cathelicidin antimicrobial peptides, a class of antimicrobial peptides, are critical to go fight microbes, but you can't produce them without vitamin D. So simply put, the cathelicidins are what are created by vitamin D. And we're going to walk you through that. So here, what we can see is that as we go through this, here we're looking at one of those alveoli again. This is what we call the epithelium, okay? And you have all this mucus here. And when the air comes in, or when the virus comes in, these little particles down here to the left of TNF and IL-6, and these blue structures are your macrophages, okay? When the virus comes in, your macrophages interact with the virus, attempting to take it out. So the macrophages interact with the virus, and let's zoom in a little bit. By the way, there's two types of macrophages, pro-inflammatory and anti-inflammatory. For antiviral activity, as you can see here, you need the pro-inflammatory. So the pro-inflammatory are the ones that are involved in antiviral activity. And by the way, this is a great paper which talks about the role of vitamin D supplementation in TB and HIV. And the reason I bring this up is people just thought this antimicrobial activity is just bacteria, but it's not. It's bacteria as well as viruses. Now you can get vitamin D from milk, but one of the best sources is from the sun or from salmon and eggs and these kinds of things, which is vitamin D3. So D3 is what we're really talking about as one of the most important for you to consume to support immune health. And as D3 goes in your liver, it's processed and then it's broken down into versions of vitamin 3 that your body actually uses. So here, what you're seeing right here is the vitamin, is that it? Yeah. So here, the red is, in this case, we're looking at TB, bacterium. Alternatively, you could also look at a virus. As it comes in, there's a process that takes place here, which you're going to follow very carefully, that vitamin D is involved in the upregulation of these cathelicidins. So let's go a little more in detail. These cathelicidin antimicrobial peptides, CAMPs, antimicrobial peptides, as I've said, are the oldest mechanism of action towards microbial pathogens. And they're conserved across evolution, across several species, and they involve pathogen cell wall membrane disruption of bacteria and viruses. So just to put, these cathelicidins, these antimicrobial peptides have existed for many, many billions of years. And they're evolutionarily conserved, which means they occur in many, many different species, which is also important to remember. So they're a very powerful weapon across species. And what these cathelicidins do, think of them like bullets. They literally go break up the cell wall or the walls or the membranes of bacteria and viruses. So when you take vitamin D, you create these cathelicidins and they literally go disrupt the cell walls of those bacteria and viruses. That's why they're important, antimicrobial peptides. And remember, I talked about this about over a month ago. So let's walk you through what happens here. How does this happen? These are sort of these are called molecular pathway diagrams. I spend probably, in a day, I'll probably review hundreds of thousands of papers where I'll be looking at lots and lots of these diagrams, so it starts giving me sort of a systems understanding. So here is, just think of, this is vitamin D3 in your blood. This structure that we're looking at here, this little edge here, and the gray structure, this is actually your macrophage. This is where all the activity, this is your cells, those are your cells that are involved in grabbing that virus, bringing it in, and trying to take it out, right? So they bring in the virus, and then they take it out. And this is how that process actually works. So you get vitamin D. Vitamin D goes through a series of chemical reactions here. By the way, this darker structure here is your nucleus. So when vitamin D comes in, it literally creates a series of reactions that create what are called vitamin D receptors on the cell surface, vitamin D receptors. Those vitamin D receptors connect with the vitamin D, and then through another series of processes involving your genetics, it upregulates these little CM, these little dots right here that you see, these little circles. These proteins, these cathelicidin antimicrobial peptides, are involved in capturing the virus. So now we're looking at HIV here, a virus. They're involved in bringing the virus in, basically capturing it, and then over here destroying it, right? So the cathelicidins are involved in many processes, capturing the HIV, like basically throwing a net around it, the virus, and then once it's captured, blowing it up, and we'll walk you through that. So this is another example of the same thing, vitamin D coming in, the cathelicidins. This is grabbing the tuberculosis bacteria, and same thing, disrupting it. The reason I wanted to share both of them is vitamin D is important for capturing the virus as well as for capturing different kinds of bacteria in terms of the cathelicidins, the vitamin D process with cathelicidins. So here, this is a wonderful paper that came out recently. You can see in March of 2019. It's very, very new stuff. So when I'm doing a lot of research, I'm not only looking at old stuff, but I try to keep up to date, even on the order of months. This is why most of the people in the mainstream media are behind. A lot of the grifters you see talking on the internet, who frankly, unfortunately, watch which way the wind blows. Should I be hyping up COVID-19 or should I be going the other way and attacking Fauci? They sort of confuse the discourse because unfortunately they don't go to the latest science, and this is the latest science that we're looking at here. So what you see here is this says cathelicidins, PM 36, LL 37, and Cath2 are similar peptides with different modes. What are they saying here? There are different kinds of cathelicidins, right? Cathelicidins are those things that are created by vitamin D to take out the bacteria and the viruses. So in pigs, you have what's called PMAP 38. In humans, the one that they've mapped is LL 37, which we'll focus on, and Cath2 are the ones in chickens. So these cathelicidins, as we said, are conserved evolutionary wise. They show up in chickens, they show up in pigs, and they also show up in us. Chickens are birds, and they show up in mammals, including us and pigs. So that's one of the important things. They show up in a number of different species. And what this paper was extraordinarily good at was, look what it says here. For those of you again seeing on Instagram, you can see this. It says almost all cathelicidins show up in simple media, direct antimicrobial activity against many different bacteria, viruses, fungi, and parasites. So that's important. It's not just bacteria, it's not just viruses, but fungi as well as parasites. Really, really important for immune health. Extremely important. So here, I want to just show you chemically, this is what they look like structurally. This is sort of the protein structure, a little bit longer of the pig cathelicidin. This is of the chicken, Cath2, and this is a human, right? Here, there's a human one, LL37. And what you can see here is as you increase the amount of concentration of these peptides, look what happens. You have more killing activity. More concentration, the amount of bacteria drop in concentration. So increase the amount of cathelicidins and you reduce. And that's true across pigs, it's true across chickens, as well as humans, LL37. And how does these cathelicidins work? And this is pretty cool because what happens is when you get vitamin D, your body creates these cathelicidins. So you need the vitamin D3. Your body makes these cathelicidins, and they literally go around the surface of those bacteria. They go around the surface, which is the membranes, and they literally sort of eat away at them, fire, what I call fire bullets at them, and break up the membrane. Very, very important. And why is that important? Because as viruses are coming in, you want to destroy them before they start replicating, before they start using your cellular machinery to destroy your body. So that's what we're noticing here. We see the human cathelicidin peptide, LL37, and then we're going to zoom in on the bacteria here. Same thing occurs with viruses. Those are those little red structures, you see? They surround the cell membrane, the cell wall, and they literally create like a carpet-like action, and then they start breaking up the cell membrane, and then you have the leakage of the intercellular contents. Basically, you've blown it up. Okay, that's what happens here. We've literally blown up, and here's another example of it. Same here. Here's a bacterial wall. It attaches here, and then you blow up the bacteria. What I want to share with you now is this is literally looking through a microscope, and we're going to show you an example where you have, in the case of a bacteria, in the case where it's normal, and then in the case where the catholicedins have hit it, and you'll see how it starts perforating the bacterial wall. So this is literally, it's not just cartoon diagrams, it's the actual effect here. So by the way, here's control. So if you notice on the left side here, these are the bacteria well formed, their walls are nice. This is in pigs, you can see they're starting to get destroyed. This is in Cath 2, in chicken, and this is in us. And just zooming in on it, you can see it here. So nice, beautiful bacterial walls, nothing has happened to them. And now this is with the LL37 catholiceds. You can see it's all fuzzy around here, and same here. So what we're really looking at here is that the catholicedins, we're looking at particularly the human catholicedins, which is what gets produced when we take vitamin D, blow up or disrupt the walls of the bacteria or the virus. That's what's extraordinary about this. It's really pretty amazing. So in closing, vitamin D deficiency leads to weakened immune systems. It's essential to create these catholicedin antimicrobial proteins. The best source is sunlight. Like we went out today, we were all out there. Dietary supplements, the D3, fatty fish, salmon, sardines, the cod liver oil. And just to give you an idea, the market size is not like the vaccine or the pharmaceutical market size, billions of dollars. This is very, very cheap stuff, about $1.7 billion, and the annual growth rate is 2.3%. So as I've been sharing, we really need to understand, why does Fauci, why does Bill Gates, why do all these people, why does Twitter, why does Facebook censor people when they say vitamin D has antimicrobial activities? That is, that it has activities to support the respiratory infections, which means take them out. I did a tweet, they put me in Twitter jail. Never happened to me. Unbelievable. So some call center rep somewhere, because of the diktats of Mark Zuckerberg, is telling an MIT PhD in biological engineering, an expert in the immune system, that putting this kind of truth out should be censored. It's quite unfortunate. What I have to share with you though today is, because of the videos that we've been doing, there's a new study that just came out in a good way, in a very timely way to what I've been sharing, but also the New York Times is being forced to admit, the New York Times always does this to save face. They need to keep their readership, because the readership starts saying, hey, how come New York Times you aren't talking about the facts that I just heard from Dr.SHIVA, as an MIT PhD. So in order to save face, they're forced to tell the truth, but they're not truthful organizations. They do it so they can keep you buying their newspaper. But here what we're seeing is there's literally an increase in the growth of vaccines, right? You have global vaccine market of 60 billion. They're doubling every 6 years, and their driver of the growth is increase in infectious diseases, and they're projected to get about $120 billion. Very small, so this is a fraction of the market. So it's not like people are making a lot of money selling vitamin D. However, it's very, very valuable for our health. This is why Big Pharma doesn't want to talk about vitamin D. Just again, look at the difference in market share here. 1.7 billion by 2025. Vaccines, 120 billion by 2025. So you're looking about 100x more, right? Is that about 100x? Yeah, about 100 times more. $1 billion in market size, 1.5 million for vitamin D, but 120 to 150 billion, 100 times more. Okay? That's why they don't want us to talk about vitamin D. That's why Fauci is not talking about vitamin D, because his masters are not going to support him. He won't get to go to their nice parties. He won't get to have his job. That's how he's been able to survive for over 6 presidents, because he's literally a front man for Big Pharma. Not one word has he said about vitamin D. But let's go over here and look at this study here. Let me switch here. So as I mentioned, a recent study came out, and let's go over to it here. Let me bring it over here. And what you see here, let me go to my, so this paper just came out, and you'll see this was done, a very nice paper done in Ireland. Okay, and it says vitamin D deficiency in Ireland, implications of COVID-19. So this is done for COVID-19. Results from the Irish Longitudinal Study of Aging, TILSA. Okay? But they did it, the D with longitudinal tilde. So what you have here is, it's a very interesting study, and you can get it, if you notice the date here is April 2020. So this is literally hot off the press, and it's done relative to COVID-19. And a couple of things that the individuals point out in the early part of our paper, the part of the paper which I'll go through. I just finished reading it so I can summarize the key elements here. The early part of the paper, what they've done is first of all, they acknowledge that right here, they look at previous studies. They said recently a large meta-analysis of 10,933 people from 25 trials conducted in 15 countries investigated whether taking vitamin D supplement helped to prevent colds, flu, and chest infections, acute respiratory infections, ARIs. Vitamin D had a significant protective effect when it was given daily or weekly to protect with lowest vitamin D levels. The risk of having at least one ARI was reduced 60% to 32% in these people. This is why in the letter I wrote to President Trump, we should have gotten people back, healthy people, supplement with vitamin D, because you're reducing their chance of getting those respiratory infections by 30%, 28% if you want to be exact. That's huge, 30% reduction. And that's why, and this was what I recommended to the president was around 5,000 to 10,000 for adults and about 1,000 to 2,000 for young people. In their study, they're recommending around 2,000 to 5,000. But the point is, here's a study that is reviewing a study that was done, which is the one I reviewed earlier, that has 60 to 32% reduction. Massive. And yet, Fauci, and no one talks about this, does not want to talk about this. And this other one said, overall vitamin D supplements reduce the risk of having at least 60% to 30%. Now, another study in 2019 said a newer analysis using 21,000 participants from across 8 studies showed that those with low vitamin D levels had a 64 increased chance of community-acquired pneumonia. 64 increased chance. And remember, this is not a small group. 20,000 participants. It's not cherry picking. So again, this evidence is not talked about by Fauci or BRICS or the CDC or the WHO in terms of what you can do to support people right now. Now let me go to the end of this article here. Go back to this. And this was the conclusions of their paper. It's quite extraordinary. It's a great paper. If you have time to read it, you can get it online. But this paper, at the end of it, this is what they concluded. Okay? This is a conclusion? Yeah. I'm sorry. Yeah. So here's their real conclusion, what they took away from this, okay? I'm sorry, I think it's right. Yeah, it's right here, okay. Here's the lung, so look what they're saying here. Vitamin D status by obesity and respiratory lung conditions. Remember, one of the important things is people have obesity and pre-existing conditions, diabetes. These were one of the people that had a high proclivity for getting getting the infection. So, but overall, it's you can see there's a massive reduction. It says, for example, here, for instance, in those aged 55 years, let me go back here. Those aged 55 years or more, the prevalence of winter deficiency was 38% in those with lung conditions versus 28%. Similar trends were observed in 70 plus age groups where rates were 32 versus 29% in winter and 16%, nearly half. And then in the conclusion parts of this, what they particularly conclude here, let me go to that section here to find it here. Here's the main conclusion. So if you look right here, they talk about a variety of sources that you can get vitamin D. A number of sources that we can get vitamin D from, including fish, the fatty fish, etc. But the report demonstrates, this is the key thing, that of particular concern is that nearly 30% of those 70 plus and 40% of those 85 plus are deficient in vitamin D. So just think about that. That's the deficiency level, 30% aged over 70 plus and 47% over 85 plus. And remember, these were the age groups that have been significantly being affected by COVID and coronavirus. And by the way, coronavirus, as we talked about, is a virus that's quite common, but this is a novel coronavirus that they're talking about. So the bottom line is that people are very, very deficient with vitamin D in these groups. And it says this of key importance given the usefulness of vitamin D for immune function, particularly at this time. Of particular concern, we have observed very high levels of vitamin D deficiency in those who are obese and those with pre-existing lung conditions, of which we have been observed to make individuals particularly vulnerable to COVID-19. Let me repeat that again. Of particular concern, we have observed very high levels of vitamin D deficiency in those who are obese and those with pre-existing lung conditions, both of which have been observed to make individuals particularly vulnerable to COVID-19 and complications from the virus. So this is why I put in my letter to the president, those people who were pre-existing conditions, for God's sakes, give them a high dose, 50,000 IUs, to really boost them up over 2 days. 50,000 one day, 50,000 the other day. Now, this, even in the literature, this is well shown. It's not toxic because you're giving them a lot, and when people are under those pre-existing conditions, it really boosts them up. Those of us who are adults, 5 to 10,000 IUs, what I take for myself. It's what I put in the letter to the president. And then, obviously, those people, children, a lot less. And everyone should consult with their doctors, but the levels that I take and what I put in the letter are well-researched numbers. And then in closing, what I want to talk about is a very interesting article that came out in nothing else than the New York Times. Okay, the New York Times, which always, supports Big Pharma, always wants to make sure that they're supporting the establishment. And given over the last 5 weeks, I've been hitting very, very hard on this. Even the New York Times a couple weeks ago was forced to admit this, was forced to acknowledge the facts. And this is what they said. By the way, this is the New York Times. Can I boost my immune system? So let's think about that. I never thought the New York Times would be talking about boosting the immune system. Where do you think they got that? Again, I take that as a great compliment, but they were never talking about that. It was always poo-pooing stuff, always saying that Trump did the wrong thing, always trying to attack the situation at hand. And here, the New York Times is writing an article about, can I boost my immune system? And obviously they couch it. Fears about coronavirus have prompted online searches and plenty of misinformation about how to strengthen the immune system. Here's what works and what doesn't. Anyway, let's look at what they finally acknowledge does work. And right here, I want everyone to look at this. Look what they say. Why would vitamin D lower risk for respiratory illness? Our bodies need adequate vitamin D to produce antimicrobial proteins. It's actually peptides. It's okay, we'll let them get away with that kill viruses and bacteria. Quote, if you don't have adequate vitamin D circulating, you're less effective at producing these proteins and more susceptible to infection, says Dr. Adit Ginde, professor of emergency medicine at the University of Colorado School of Medicine and the study's lead author. These proteins are particularly active in the respiratory tract. Everyone just look at that. If you don't have adequate vitamin D circulating, you are less effective at producing these proteins and are more susceptible to infection. These proteins are particularly active in the respiratory tract. Now, why is it that with my meager equipment here and this lighting, I've had to do these videos and they're getting out there, but why is it that Fauci, who's been in there for over 6 presidents, is not advising the President of the United States about this, is not supporting the letter that I sent to the President talking about taking vitamin D? Is it because they're waiting for embarrassment of their fake science, that finally the truth is coming out there, given that no other academic out there will even talk about it, that when we hit hard and then finally people are given the truth, then the New York Times follows. And it's about time we stop listening, and stop waiting for the mainstream media to tell us what the truth is. When you have someone like myself who actually studies this, you don't have to go through some journalist. You can go direct to the source. You can go direct to a scientist like myself who studies this for a living, who's got the degrees. It's time that we start appreciating people who use their brains and work with their hands, be it the plumber, the electrician, the nurse, who are on the front lines. and stop listening to journalists. Journalists are scribes. They wait to watch which way the wind blows. By that time, we've lost thousands of lives. That's why in the tweet that I put forward is that if Fauci had advised the president to follow my letter, we could have saved millions of jobs. Literally millions of jobs, because people could have been working without fear. And we could have saved the lives of those critically ill with high-dose vitamin C. We could have saved the lives of the immunocompromised with high-dose vitamin A and D. And we could be protecting ourselves and getting back to work. It is so, so, so disgusting. When I study the science, I put my hard work into understanding it at the molecular systems level. Many of my colleagues see it. The guys in academia know it, but they shut their mouths because they're afraid of stopping getting their grant funding. And then you have someone like Fauci sitting there in the middle of a crisis, him and Bricks not saying anything. And then you have a lot of really stupid people on the internet, a lot of grifters who watch which way the wind blows. Some of them are hooked on to Bill Gates. They want to kiss up to him. They think he's a smart guy. You know, they've been bamboozled. The guy has no degrees in the biological sciences, has not studied this. But again, I want to share with you here, the New York Times is forced to admit this now. If you don't have adequate vitamin D, you are less effective at producing these proteins. These proteins are particularly active in the respiratory tract. That's what we're talking about. And if you go back to the diagram I shared, those proteins are the cathelicidins. And here they are. For everyone to understand, you know, and here's the science. They're these beautiful little proteins that when you take them, they go bust up the cell walls, the cell membranes of bacteria and viruses. Boom, boom. That's what they do. That's what's going on here. And it's time that we stop listening and waiting for these grifters who watch which way the wind blows. You know, you got to really start wondering about these people on the internet, with the kind of content they put out there. What are their qualifications in terms of, are they doing the scientific work, the engineering work, etc.? And then you have to also start wondering about the academics who've been staying quiet, and definitely we need to admonish people like Fauci. So there you go. I hope that was valuable. Let me just see what we got going on here if you want to take any questions from people. Change.org is owned by Gates. What do you expect? Exactly. Bill Gates has no medicine. He's creepy old something. Okay. One of the things I want everyone to also remember is that if we're going to attack Bill Gates, let's be very clear. We also need to attack Hillary Clinton. Let's not forget her. Gates and Hillary Clinton work hand in hand together. They're both pro-vaccine. They both want mandated vaccines. They both want to vaccinate everyone. My position is it's not a pro-vax or anti-vax argument. It's about medical freedom, that each one of us should have the rights to decide what's right for us in consultation with our healthcare provider. But what Gates wants is he wants to mandate vaccines. And remember, this is a part of his larger way he looks at the world. He looks at the world from an operating system standpoint. And I'll be doing a talk on this tomorrow. But he looks at the world from a world of operating systems, which means the way that he monopolized with Microsoft was he owned the operating system of the computer called DOS. And that's how he monopolized all the applications above it. And I'll talk about that tomorrow. Now, when he views us, he wants to own our operating system. And what is our operating system? The immune system. So Gates' big plan, and by the way, this is not something that is not ill-planned. He brought in some of the smartest guys from McKinsey. He set up the Global Vaccine Alliance with Hillary Clinton, Bill Gates. So if you see people attacking Bill Gates and they don't attack Hillary Clinton like Bobby Kennedy, suspect. Look, it's easy to attack Bill Gates and get all, yes, we don't like Bill Gates. But remember, they're one incestuous family. So if someone attacks Gates and does not attack Clinton, they're part of the not so obvious establishment. Okay? That's what's going on. So Gates, Hillary Clinton, and their goal is to own our immune system. They're really the fronts people for the trillion-dollar pharma industry that's failing. We'll go through that in detail tomorrow. But what the most important thing we need to take away today is that we are now starting to see that the mainstream media with the vitamin C, IV dosage, high dosage C, as well as with vitamin D, does work. And in order to maintain their credibility, remember, there's still fake news. in order to maintain their fakeness, they're in an ironic way having to acknowledge what I've been sharing with you. So this is a good thing, right? Because at least it's going to reach more people, but it's coming from our bottoms up pressure. They're not doing it on their own. Let me look at what's going on YouTube. Any questions here? Learn your knowledge. Okay. People are coming there. Good. Anyway, if there's no other questions, thank you everyone. But tomorrow I will be doing a thing on the operating system, of how Gates works and how he wants to monopolize our operating system. But anyway, I hope this was valuable. I wish you all well. Thank you. Good night.